Prostitutes Education Project. They will discuss provision of HIV and related services during COVID, sharing both best practices and impediments. These women have extensive experience working in HIV and related fields, reaching and serving diverse populations most impacted by HIV and co-occurring conditions and circumstances, including the homeless and marginally housed, elders, incarcerated and recently released individuals, MSM, the transgender community, sex workers, both females and males, and women. Given the limited amount of time, I'm not gonna just go through their whole bios. I mean, it's a lot more in their bios than what I've mentioned here. So without further delay, we're gonna start with Gloria. So Gloria, you have the floor.
Hi, good morning, everyone.
Good
So
morning.
wonderful that you could all join us. And I want to say thank you, especially to Barbara, for inviting me to be on this town hall panel with all these other wonderful experts. So thank you again, Barbara, and thank you to CAPS for having us all. Let me start out by saying 2020, wow, where are we? You know, we've gone through the pandemic, the start of the pandemic. I feel like we're in the middle of the pandemic still. We've gone through these wildfires here in California, waking up to what looks like we're on Mars, and, you know, all of the other things that impact us. And one of the things I know for sure is what we're all experiencing is probably exacerbated even more with those who are living with HIV and AIDS. And so I'll start by sharing what we do at Allen Temple. We have had a contract for many, many years to do a congregate meals hot lunch program for people who are living with HIV. And I feel like it's gone pretty well over the years. Our primary population that joins us for this lunch is an older population of people who are living with HIV. I would say primarily over 45 years old. They join us on Tuesdays, Wednesdays, and Thursdays for a hot lunch, nutritionally prepared. And we get clients from all of the other agencies, Cal-Pep included, World included, and they kind of see that congregate meal setting as a place where they're safe and they can chat with each other. And one of our primary goals is to reduce isolation. And I think we do that pretty good. And once a month, they have been going to Movie Tuesdays. And, you know, all of those things are wonderful to decrease depression, decrease isolation. And then there was COVID. So what do? Our hugest challenge has been, how do we still make sure that these folks get nutritional food, continuing in the lunch program and vein that we have been doing. And so what we started to do is deliver weekly bags of groceries. And that's been going on since March. Allen Temple has had a 20-year history with the Alameda County Food Bank. And we distribute bags of groceries to the community. So every week we pick up a bag of groceries and we deliver it directly to clients' doors. That had been going on pretty well because it gives us an opportunity to put eyes on the client, see what's going on with them, you know, kind of, you know, let them know that we're still in touch with them. But I didn't feel like those grocery bags were enough. You guys have seen probably, as well as I, what comes in a grocery bag from the food bank. It's a can of this and a few potatoes, a few tomatoes, some apples, orange, maybe some pasta. And so about a month ago, in addition to the bags of groceries that they get, we have included prepared meals. We're part of the World Central Kitchen distribution, and we have been just purchasing meals and delivering prepared meals along with those bags of groceries. I feel like that's going on pretty good. Clients have really very much enjoyed getting those prepared meals every week, and I feel like that part is going pretty good. Another part of our program that we do is anger management programs. And this is what I really wanted to talk to you all about today. Our biggest challenge with still providing our face-to-face anger management classes has been technology. And I don't know about you all, but over the summer, I had some wonderful interns, and we had planned all of these great virtual lunches with our HIV clients, and they were decline. They were not interested in coming to a Zoom meeting like this and having a virtual lunch. We were going to make it fun and do nutritional tips and tricks. And, you know, every time we would check in with them, they were like, no, we're not really interested. So we learned that technology is not really that friendly to how we stay in touch with our clients, particularly those who do not all have access to the same kind of internet connection or equipment that is necessary. And that's a huge lesson that we have to learn. We have kind of shifted our way into still doing some face-to-face stuff by delivering these meals and bags of groceries, but we're still finding some big technology challenges and how to stay in touch with people. Um, and we find those technology challenges very clearly in our anger management programs. Those anger management classes every week are court mandated. And so I guess we were in a bit of denial since the beginning of COVID. Never thought that we would still be trying to gear up and do virtual stuff. You know, here we are in September, but here we are. We have to figure it out. And we are noticing more and more that all of our clients, those both with living with HIV and those who are part of our anger management programs, they are not all technology savvy. They do not all have internet access or hotspot access, and they all don't have the either desktop, laptop, or phone to stay with us on a 2-hour anger management class. It's been, I would say, pretty doggone challenging to make sure that we're able to communicate with them, they can communicate with us, and it's been very, very hard. So just like all the students who are in school right now and, you know, elementary age, middle school age, those schools had to make sure that their students had the level of equipment that they needed, as well as the internet access that they need to be able to actually attend the classes. That true has been a challenge for us as well, trying to figure out how do we get folks the internet connection that they need. And then more than that, I failed to mention that those anger management classes are fee for service. How do we receive payment from them as opposed to them handing over their fee in when they attend class? So in this challenging time of COVID, I think what I'd like to share with all of you is what we have learned mostly is we need to individually take a look at folks' technology access, equipment access, and their proclivity to even want to do those kind of communication methods with us. Moving forward, I think once the church reopens, Allen Temple Baptist Church is where we provide all of our services, and we've been closed at the church location since March. as we move forward and the county guidances change and we're able to get back into kind of more face-to-face with social distancing, we're going to still need to figure out how we include these virtual technologies and methods to still offer the classes that we do. But for a congregate meal setting, for people living with HIV, I think our biggest challenge is to figure out how we're going to reach out and touch them, how we're going to really keep them close to us, because we are learning that isolation and depression are huge factors for people in this time of COVID, but even more so with people who are trying to keep themselves safe at home because of their decline and well, maybe not, I don't want to say declining, but their underlying health conditions. So these are all challenges that we're facing. Love to hear any ideas from you. Love to, hear other suggestions from you and from providers, because we are concerned about this population of people who are living with HIV over 50. We want to make sure that, they still know that they have someone to reach out to and a safe place to come to once we ever get open again at Allen Temple Baptist Church. I don't even foresee us opening until 2021. So we still have some months to go and some hurdles to cross. But in these times of COVID, we've all had to adapt, to change, to figure out what we're going to do to the best of our ability in serving our clients. So that's what I'll share with you guys all today.
Thanks a lot, Gloria. And we, at the end of the town hall, we'll reserve some time for Q&A. And so hopefully some people can come and share with you in terms of your requests, what are our ideas. So the next person is Julie. And I think that Julie has some slides. Are you still going to be sharing slides, Julie?
I am.
Okay.
I am.
So Julie has slides, and when we do community town halls, either you can bring slides or you can just talk. And so Julie opted to bring slides.
Good morning, everybody. Thank you so much, Barbara, for inviting me, and CAPS for inviting me. And I am honored to be on this panel with these incredible women doing really important work. I apologize ahead of time that I may get some pop-ups from my Teams messages on my computer. I haven't figured out how to turn that off. So I am Julie Lifshay. I'm the director of the Housing, Aging, and Retention and Care Department at the San Francisco AIDS Foundation. And I just want to clarify that my department does not include our testing services, our PrEP services, our initial linkage to care when people are first diagnosed with HIV, our interim ART program, and our incredible Stonewall program. So we could spend a lot of time talking about other really important work that San Francisco AIDS Foundation is doing. But today I'm going to be talking about the programs that are within my department. I am lucky enough to be the director over all of these incredible programs, and they include the Housing and Financial Benefits Program, the Black Brothers Esteem Program, the Elizabeth Taylor 50 Plus Program, our Centers of Excellence, and our Services Navigation work at our 1035 Market location. I've mentioned the managers and the supervisors of these programs here because I'm really representing their work. I have the luxury of being able to work side by side of these incredible folks and their teams. And so I'm just here to tell you about what they've been doing. Prior to COVID, we had weekly drop-in social support groups. Some of those groups had upwards of 60 people at a time. We were providing in-person dinners and lunches and snacks. We had weekly book clubs. We had monthly game nights. We had weekly, and in some programs twice a month, in-person steering committee meetings. We had in-person check-ins with providers, and we sometimes accompanied clients to appointments, to services that they needed help accessing. We also had every 6 months in our housing and financial benefits program, we did in-person check-ins at clients' homes. We did yearly home visits. We did annual retreats with clients. We did quarterly events. We did holiday celebrations. So we had in-person remembrances, and we had drop-in hours at our offices. So of course, everything has changed. We've been these programs that I'm covering today have been entirely virtual since March. So that does not include, we still have in-person testing, we still have PrEP, we still have a lot of in-person services at our Magnet location in the Castro, but the programs that I'm reviewing today, we have been entirely virtual since March. Our successes, we have been able to continue to provide housing subsidies, benefits counseling. We've been able to continue most of our social support programs multiple times a week. We've actually increased our one-on-one outreach and check-ins with our clients in a lot of these programs. We've been able to continue to provide case management services, linking people to their appointments and other resources, some of which have changed, obviously, since COVID. We still have office hours. We've expanded office hours, and people are clients are much more able to contact people via phone and email than they were prior to COVID. Some clients we've been able to reach more frequently than we had prior to COVID. And we've even launched an HIV and aging case management program that we had started to plan for before shelter in place, but we launched it since March. Other successes is that we've actually increased collaboration across programs within the San Francisco AIDS Foundation and with other organizations. Some examples I list here from our Phoenix Rising program within the Black Brothers Esteem program, the BBE program. We've had some presentations about harm reduction to approaches to physical distancing by our Stonewall staff. We've had National African American HCV Awareness Day from our Hepatitis C staff. We had a session on sex during COVID-19 that included our PrEP and HIV benefits staff, as well as collaboration with an outside organization. We've had discussions about COVID-19 in the Black community that included Bridge HIV and Dr. Hyman Scott, who is on our staff. We've had, we're going to be having PrEP, PEP, and HIV benefits and services discussions, and we're gonna actually be doing a cooking in small spaces presentation during our game night prizes events with BBE. So that has really expanded our internal collaboration. And COVID has allowed for increased opportunity for new members and participants that weren't necessarily able to join us in person from across the Bay Area. So we've opened up our services to other organizations and to other people. And because things are virtual, people don't have to travel. Say if they wanted to come from Fremont to San Francisco, but they weren't able to make it, they're now able to join our programs. We've also been able to provide masks to participants. In terms of the percent of clients that we've reached since March, these are estimates, but we've reached anywhere from 70 to 90%, as you can see across the programs that are in my department. Again, these are estimates. However, our services navigation program, which is our lobby welcoming space for people, where we had a lot of drop-in clients, people coming just for snacks, just for a respite, just to use the computer, just to use the phone, potentially find out about our resources. We don't have that space. So we do have some phone calls. We're checking and monitoring our phone line, but we haven't been able to see those people. Some of the methods that we've used to accomplish these successes is we've really relied on the input from participants. That's the first thing I want to emphasize. We've checked in with clients. We've relied on our steering committees. Obviously, we've transformed our in-person services to online. So of course we have Zoom meetings, often at the same regularly scheduled times that we were having meetings before. We have our game nights, but they're virtually now with prizes that we then mail to people. We've altered our in-person reading groups to virtual audio groups. And large in-person gathering spaces have changed to Zoom, where we often have these breakout rooms, and that particularly applies to our 50+ program. We've had to make adjustments, of course, For instance, we used to have movie nights. Those aren't available on Zoom platforms. We've had to decrease the time of some of our events. Some of our events were 4 hours. Can't really do a Zoom meeting for most folks for 4 hours. And we used to have in-person testing at some of our events, but that's transitioned to referral to our magnet program. Other methods that we've used to accomplish these successes is we've provided technology training to our participants. We've actually provided technology. We provided some phones, some iPads, some headphones, speakers to people. In very rare occasions, we've provided delivery of food for special events, for celebratory events. We've provided resource guides to folks around food security, around other events that are happening at San Francisco AIDS Foundation about mental health resources. And we've created some spaces, very rarely, where people, if they choose to, can meet in person. We've a coffee shop where folks used to meet. We've footed the bill, and people can use a certain amount of money to get a coffee if they chose to meet in person. And we've relied on community providers. We've really increased our coordination with community providers, sometimes reaching out to people just to get in touch with a client, knowing that someone may not have a phone or we're not able to reach them, but maybe living in a housing situation, and reaching out to those community providers. And we've also increased our regularly scheduled check-ins with other providers to find out about clients and to just keep in communication. We've incentivized participation. We've provided food and grocery gift cards. We've gotten donations, and mostly masks from other folks that we've been able to send out to clients. We have monthly newsletters that have been going out, text reminders to people to remind them of our Zoom meetings. We didn't have that prior to COVID. We've increased our posts to social media, and luckily we had some video stories in the bank that we then produced as a result of being a shelter in place to have clients feel more connected to community. The barriers, which Gloria went over very well, are access to phones, but Wi-Fi and minutes and connection to Wi-Fi, people's comfort or knowledge of technology. Some folks constantly lose their phone, and some people only have landlines and no internet. There's mental health barriers to people participating at regularly scheduled times and on Zoom calls. Substance use and mental health issues interact and can be a barrier to people keeping track of the time and when our programs are happening. And then there's the mental health, substance use, isolation, feedback loop that happens a lot that's been happening a lot during this time. Obviously, clients are experiencing isolation, and that leads them into crises. But in addition to that, some folks are experiencing PTSD from the HIV/AIDS epidemic in the 80s, and that is leading them to actually isolate. So it increases isolation. So COVID is increasing isolation, and then people, as a result of having PTSD, are also isolating more. All of that leads to crises. In terms of staff, we have limited staff capacity to provide individual support. Our staff are also experiencing trauma of everything that is going on in the world, and in the US in particular. And as a result, we have staff burnout. And there's trial and error of certain things. We tried to do a DJ dance party, and that didn't carry over well into in Zoom world. So that's been a barrier to some of our services, is just how do things translate on Zoom and in the virtual world. Some programs are not designed to communicate via social media, so we've just been not able to access that. And we've had to put a number of programs on hiatus because they are just in person by their nature. And the biggest barrier is clients that have no supports whatsoever. They don't have technology. They don't have a person that could help them get access to technology. They don't have a person to link them to the phone. That's been the greatest barrier in terms of the clients we are just unable to reach. The lack of a drop-in space, as I mentioned, we're not reaching clients that would drop into our space, and we had no other way of identifying them or providing services to them. And hearing and sight issues have been a big challenge for some folks, because Zoom is just not kind to people who have hearing and sight issues. The post office, as we all know, our postal system has had some challenges and some underfunding and some changes, and that has resulted in us not being able to reach clients with supplies, with the masks, with the incentives and the gift cards, with the things that we need to communicate with resource guides that we're trying to communicate to them. And then clients that are in group living situations, they don't have privacy to participate in the Zoom meetings or to have private one-on-one check-ins. So in groups situations or shelters, we're not able to provide the services, the virtual services. There were some recommendations in there in terms of our methods, but I just wanted to emphasize that when we have the chance, when our shelter in place, when COVID is over or has subsided to some degree, let's take that opportunity to provide folks with cell phones. Let's take that opportunity to provide the in-person technology training and practice that will benefit us moving forward. Let's keep their contact information updated and varied. Get as many pieces of contact information we can have for them about their providers, about their family, about where they hang out, about how we can reach them. And let's recruit and involve participants in the planning, creation, outreach, and facilitation of our programs. That has been crucial to how we have designed our response to COVID, and make sure that our content and our program content is culturally responsive to the moment. That is it. There's my contact information.
So thank you so much, Julie, for that presentation. And like I said, we'll get to questions and answers at the end. So now we have Tania from Whirl. And so we would love to hear about this organization that primarily serves women.
Thank you, Ms. Barbara. I truly appreciate yourself and CAPS allowing me to join this wonderful panel of women that again are doing great work in the community. And I just want to add to that. So I'm just gonna hop right on in and just introduce myself, give a little background history of World, and give you our successes and barriers during COVID. So good morning again, you all, and thank you for having me. My name is Tania Briggs, and I'm here representing Women Organized to Respond to Life-Threatening Diseases, or better known as World, under the direction of Miss Ingrid Floyd, who is our interim ED and current ED of Iris House in New York. We were founded in 1991 by Rebecca Dennison, who had a mission to provide services to women living with HIV and other chronic illnesses, which were relevant to everyday living, while always keeping in mind that their diagnosis didn't define them as individuals. And our mission overall is to improve the lives and health of women, girls, families, and communities affected by HIV through peer-based education, wellness services, advocacy, and leadership development throughout the Bay Area. Now, we also do offer services for weekly and monthly support groups. We have several different support groups that range in variety for each group that we have that comes to World. As mentioned before, we have peer advocacy, we have PrEP navigation, and peer buddy and leadership committee. We also have Sisters United Now, which is a project that includes East Bay STI prevention and trauma-informed care training. SUN supports Black and Brown women and girls throughout education and policy initiatives. Now, our populations that are most engaged are our African American women that are 45 years or older, and our least engaged populations are our Latina and our Latinx population, our Caucasian, and our youth population ages 17 to 24. And the reason being is simply after us taking surveys and doing polls is that the engagement was less because the clients feeling like, maybe some of their needs and services weren't being provided. They wanted activities, information, and resources relevant to the now and what's going on with their lives right now. But I am truly happy to say that all of that has changed, and World has reinvented and revamped our approach to all of our services to meet the needs of our clients. And we're now offering a variety of remote and virtual workshops, which have definitely gone over well since COVID. And some of them include our fitness and movement class, which is designed to promote a healthy lifestyle by incorporating everyday movement. Our ladies are definitely enjoying that. We have our cooking and culinary classes that we are also doing virtually, where it's teaching our ladies how to cook tasty and nutritious meals on a budget. I don't know about the other agencies, but I know here at World, our primary population is on SSI, and they have very limited income and wiggle room to go out and do additional shopping and get additional items that they may need. So we offer that cooking course and information to them so that they can be able to go out in the community and buy those items on budget and still be able to provide themselves with the nutritional value that they may need. We also offer self-care classes, which is very important during COVID right now. As all of you had mentioned, Ms. Gloria and the rest of the ladies, that isolation is very, very real during this time. Mental health is very real at this time, and self-care is important. So we're giving them the tools and the activities so that they can know what self-care looks like and how to incorporate that into their lives. We have our leadership committee, which is designed to train our buddies and our leaders to outreach, to support and connect each other and all of the rest of the women and girls to services and care. The World Leadership Committee is also very politically involved and advocates for positive change in their communities. And I'm also proudly to announce that our leadership committee will be launching their Leadership Institute on October 5th. We've also had great success in our contactless food pantry. Prior to COVID, or I'd say earlier in 2019, we had not had a food pantry. So by us implementing a food pantry and making those services available to our clients, that has gone over tremendously well with them and has knocked out some of the stress that they've had around obtaining food and maintaining their households and making sure that everyone in their household is getting a nutritional meal and nutritional value. We have financial management classes and quarterly newsletters where we're keeping everyone abreast of what's going on within the agency, services that we have going on, events, activities, etc. And then we have navigation of health services and housing needs. Now, regarding the health services, we do help with medication pickup and drop off for some of our clients because we know that transportation is an issue. And we know that with COVID, a lot of our clients are experiencing high anxiety and really don't want to go out and put themselves at even more risk of COVID. And then regarding the housing, we help with rental assistance and navigating our clients with rental assistance and our food assistance program. We also, and I'm so happy about this, are able to give them PPE supplies as well, masks, hand sanitizer, gloves, which is definitely important. And as I had mentioned before, because our clients are on limited income, it's difficult for them to get some of those items. Now, our successes during the pandemic are that we are definitely able to teach our clients new and different things with the help of technology to a certain extent. I know some of the other ladies were mentioning that technology has been a barrier for some of them. We've also been having that barrier as well. Our main population, as I had said, was 45 and older. They're not as technically savvy. So navigating Zoom or just getting on the computer in general has been a very difficult process for them. But we've tried to ease that process for them, and we've offered Zoom classes where we've actually had them come into the office, of course, socially distancing, and we've put up on the TV monitor ways in which they can learn how to download and navigate Zoom, so that they can use it in the future and, you know, for all the rest of their services that they're getting, whether it be through us or other agencies. We've had an increased census in our less engaged populations. We've also had our engaged populations becoming even more engaged. They're becoming even more interested in all of the services that we've had available to them virtually. We have also had an increase in our enrollment of new clients. COVID has made it very possible for new clients to come to us, for those clients that are living a little further out. And then we've also had new platforms for reintroducing world to the world. Via social media, it's allowing us new ways of networking. And while we do understand that our clients are human and all of their needs have not stopped because of COVID, which means that our services cannot stop, and we need to continue to provide those services to our clients by any means necessary and as safely as possible. I mentioned before that COVID has made this very difficult on our clients emotionally, mentally, and physically, but we're doing our best to try and just ease some of that anxiety for them. And, just overall, I would also say some of the barriers that we've had, again, is the access to technology, substance abuse use, because that has become higher. No internet access because of the lack of funds, mental health issues, isolation, all of those have been the barriers, but we've taken the time to try and attack each of those barriers and try and figure out different ways and how we can approach those, and definitely privacy and the support of technology help for our clients. So overall, that has been the experience that world has had with COVID, the barriers and the successes. And I definitely welcome any comments, concerns, any ideas that we can elaborate on or even incorporate. And that is it. Thank you so much, Ms. Barbara and the rest of the panel. I appreciate you all.
Thank you, Tania. I would suggest that people take a look at the chat because there are a couple of comments in there that speak to some things that you've said. Again, we'll have questions and answers at the end. So thank you, ladies, for your comments so far. And so last but not least, we have Lisa Ryan from Cal-Pep.
Good afternoon, everyone. How are you?
Good afternoon.
It's a pleasure to be here. Barbara, thank you for the invite. As Barbara said, I'm Lisa Ryan, the Executive Director of Cal-Pep. Cal-Pep is a community-based organization located in West Oakland, and we are in our 36th year of service. Our services are provided throughout Alameda County, Contra Costa, and San Francisco. Excuse me, my mask is bear with me. Mm-hmm. Our services include case management, service navigation, treatment adherence support, substance use education,
yes,
and counseling. Excuse me. HIV and HCV testing, street outreach, wellness and mental health services. We operate 3 drop-in centers for our clients. We provide medical transportation for people living with HIV. We also offer mobile shower services, which is a partnership between Allen Temple, HepPAC, and World. As well, we provide food distribution to people living with HIV. Our priority populations include sex workers, men who have sex with men, women of trans experience, youth and young adults, and previously incarcerated individuals. So COVID. has wreaked havoc on services. You know, due to COVID, we've had to modify our services across the board and implement new protocols. It's been pretty trying. You know, we're 6 months in. I think we got it. We got the hang of it. We're now offering minimal services on site. Physical distancing signage is throughout our building. When you walk in, you have physical distance signage on the floor, on the walls. We have a COVID sanitation station at the door. So when someone enters, they have hand sanitizer, they have a mask, and they get their temperatures checked. You know, pre-COVID, you could find our waiting area full of clients, 10 to 15 clients at any time. Mid-COVID now, we're only allowing 4 clients in at a time. This is pretty disheartening. You know, we're used to, it's like a family feel. Clients are able to come in and sit down. We have 3 sofas. Now we replaced them with 4 chairs, which are socially distanced, 6 feet apart. It's awful. You know, they used to come in and watch television and just chit chat. It's no longer like that. You know, when you walk in a building, it just feels kind of foreign. But, you know, we're getting used to it. We also set up a receiving station in our parking lot for clients who need to see a counselor face-to-face, one-on-one. So in the parking lot, we have a tent with a table for social distancing. We have a plexiglass, and we're able to see clients out there in the parking lot. You know, it's taking some getting used to, but it's working. And a lot of times clients want to see you. That's what they're used to. You know, virtual doesn't work for everybody. So having that option has really worked for us. None of this has been with ease for the clients or the staff, because we're an agency that's, you know, hands-on. You hear about Cal-Pep. Cal-Pep's in the community, you know, in the middle of the night, early in the morning, all day. You know, we're sitting down on benches in the park with our clients, or we're sitting just leaning against a car. We can't do that anymore. So it's a little foreign. So now all of our services are being offered virtually, including our case management. Our client intakes are virtually, one-on-one substance use counseling, as well as our substance use groups. They're all virtually. Medical adherence sessions are virtually. We're even conducting our house parties virtually. And our house parties is a intervention that we've been doing for over 30 years, where we normally recruit from the community gatekeepers who will bring us into their homes, and we would bring our services such as HIV education, HIV testing to them, and they would invite their people from their social network. We're now doing that virtually. So we're actually recruiting people and paying them a stipend to bring people into our virtual house party. It's been working, you know, so we're still able to get that education out to the community that needs it the most, but we're not doing the testing. So we're being innovative and challenged at the same time. So establishing this change in services was a big task for our staff. Not everyone on the staff is tech savvy, including myself. So our management team spent many hours training the staff on the ins and outs of Zoom meetings. I had never heard of a Zoom meeting. You know, we had to teach the staff how to send a Zoom to invite clients, when to mute your Zoom, how to present yourself in a Zoom, you know, how to block yourself out, when it's appropriate to block yourself out, you know, just kind of overall Zoom etiquette. It took some time, but I think everybody is Zoom competent. But I have to give a shout out to our wonderful management team who spent a lot of time training everybody. You know, I really appreciate them. They were overwhelmed and exhausted most of the time, but they kept going. So pre-COVID, we operated a drop-in center 5 days per week during non-traditional hours. There could be anywhere from 10 to 20 people in each of our drop-in days. People would, you know, if we were having an event, there could be up to 50 or 75 people. The center setup was very home-like. We had a sofa, a love seat, coffee table, lounge chairs, television, game room, and there was a computer lab. Participants would sometimes refer to the drop-in center as their home away from home. It was a place where they felt safe. So not being able to attend that, it's been hard on people. You know, it's triggered depression. They're asking us, when are we going to open the doors again? And we don't have an answer for them. You know, so it was a place where they felt safe, affirmed, and accepted. It was a respite from the streets, you know, from the volatile home life. There's a lot of domestic violence our clients were experiencing, and when they came to us, they were safe. That's no longer there. It was just away from the elements of the street. So it's very challenging for them. So we're still holding the drop-in centers virtually. The participation obviously has fallen off, and that's across the board. We've seen a decrease in participation, but we're still trying to hold those drop-in centers, which are very important to the community. We have people who can come into the drop-in centers every drop-in for 5 years. So this was like, a monkey wrench in their day-to-day. And each night the participants were served a home-cooked meal. We're not talking about sandwiches. We have a kitchen. We're talking about full nutritional balanced meals. And that was something for people to look forward to, because sometimes that was the only meal that they were getting. That's no longer happening. And it was like family, they would sit at the same table and eat. Nobody ate in a separate room. We all ate together. And sometimes they ate along with the staff. So it's like a loss for some of our clients. And it's even a challenge for our staff who have become accustomed to that, because we do hire from the community, and a lot of our staff represents the community that we serve. So they, as well as the clients, this is an adjustment for them as well. It's hard for me to talk about the services with the clients and not reference to our staff, because they're so alike. So this is where they came when they felt like they needed support and encouragement. If they were struggling with an issue, they could come to the drop-in center, speak with a counselor, and just be supported. And that's no longer. We've definitely seen a decrease in participation. We're also conducting street outreach differently. You know how we used to go out and we'd engage one-on-one with people and just sit and talk for however long it took for us to get our message to them. We're no longer doing that because we're limited in the amount of time that we can spend with clients. We're still canvassing the community, but we're also forced to limit our contact because we're not able to approach individuals in the way that we used to. We now go into the community and often set up a table for social distancing, and we place hygiene kits and counter kits on the table, and clients are able to come up one at a time to receive those hygiene kits or the safe sex kits. It's different how we're communicating with them now. We're communicating across the table. We're trying to be private so no one else hears, because we still have to get the message across about risk reduction, COVID care, or whatever it is that they want to talk about. Many of our clients are also struggling not only with the fear of COVID-19, but the decline of their mental wellness, their forced isolation, the self-quarantine, increased substance use, and the decrease in their mental health. And then sometimes it's all of the above. So we've had to increase our communication with some, contacting them many times during the week, just to say, how you doing? Are you okay? Just to let them know that someone's there. It's not always about your treatment plan or, a number or trying to get your intake done. It's just about being there for them and just letting them know that they're not alone. Because many of the clients do feel alone. Many of the clients are really struggling with their mental health. And at this time, they need us the most. So sometimes you just have to put down the pen and just listen. And I think that's been really effective for us. And we call them and contact them through social media. And we have to often call them to remind them of their telehealth appointment, or to remind them to participate in group. Because even for me, the days are running into each other. Sometimes I wake up and say, is it Monday or is it Tuesday? So sometimes we have to remind our clients, and they appreciate that. As I said before, recruitment has slowed down. We're not getting as many new clients as we were before through outreach and field work. And a number of our referrals are coming from previous clients or other provider sites and social workers. We found success with siphoning our clients to assist us with recruitment from their social circles. So what we're doing now, well, we've always done it on all of our programs. And right now it's so much more important because our clients are really struggling financially. So we have included our clients in the recruitment process, where we're paying them a stipend to bring people into the program, to bring them into our virtual groups, to bring them in for intakes. So that has been working for us. Some of the strategies we're using to bring in trans women, who have been one of the populations who have been hard to keep in services, is allowing them the option for telehealth, because a lot of times we're finding that a lot of ladies don't like to be on camera, feeling like they're being judged. So we're allowing them to utilize telehealth. So with that option, we've seen an increase slightly in the number of women that are coming back into service, and allowing them to have an option with what approach works for them, whether it's group sessions, whether it's one-on-one, or whether it's telehealth. It's not about our agenda right now. It's just about doing whatever we need to do to keep people in service. So we have to think outside the box and let them design their treatment and how they'll receive it. So populations that are less likely to engage in services that we found, again, as I said, women of trans experience have been less likely to engage in our virtual groups and medical services. Some have reported they don't prefer to be on camera, as I said before, due to fear of being judged. As well, like with many of the other participants, their wellness has been challenged greatly throughout this pandemic. And for some, their substance use has increased. So there's a decrease in their ability to make money as far as sex work. There's a lot of pressure, not knowing where you're going to live today, how you're going to survive tomorrow. So we've seen an increase in mental health and substance use. We've also seen that heterosexual men of color are hard to bring into keeping services. And it's pretty much the same pre-COVID. They don't feel like they're at risk of HIV and STIs, even though they may be engaged in sexual relationships with men and women of trans experience. So it's been hard to bring them into service. It doesn't apply to them. They're not at risk. Also, clients who have disengaged from their mental health throughout this, or no longer seeing a mental health specialist, have had the most difficult time in staying in care and wanting to access care. We've had clients that do not want to access medical services in fear of being placed on a 5150 hold because of where their mental health is at that time. So they'd rather not even, attempt to get into mental health or any services. Overall, again, we've seen a drop in participation across the board. And this is to be expected. We're all trying to adapt to this new normal. So some of the pandemic obstacles we've experienced in our service delivery includes providers not providing the best services due to their personal biases, which has affected clients' trust and rapport in their primary care providers. Very similar to the stigma that we see with HIV. It's so similar. How providers are now having their own biases in judging our clients because of what they look like, or what their population is. And so clients are less likely to go in for care. So they just give up altogether because they've lost that trust in their providers. Social distancing and the need to restrict or lessen face-to-face activities, such as in groups or workshops, has been an obstacle because clients don't have the freedom to drop in and see staff, on their time. It's too regulated, it's not working. Clients that do not have access to a phone or computer and have limited technology skills, we've seen success with the innovative approach in providing street outreach and health screenings. So we're still getting people to come in to the table, even though we're setting up a table, we're no longer on the mobile unit. They're still accessing services. We have also seen success in reconnecting clients into care through telehealth appointments. Clients that are not normally willing to access care are more open to telehealth. Some of the lessons we've learned from this pandemic: HIV testing needed to significantly slow down in order for us to be successful in following the new protocol. So we're not able to test as many people as we used to. There was a time on our mobile unit when we can have up to 4 people on our mobile unit in testing. Now we have to test one at a time in a tent. Another lesson learned is increased communication has been mandatory in keeping clients engaged in virtual services. So we make sure that we're constantly calling clients, either by phone or through social media. Calling clients before scheduled telehealth appointments and to ensure that they're ready for their appointments. Another lesson learned is the importance of increasing communication with other providers. We have to stay in contact with the other providers. It takes a village, and even more so now through COVID. So building those partnerships and collaboration with the other providers so you can stay in touch with your client. And when they fall out, you know, you can contact Highland or Allen Temple to find out if they've seen the client. So this is, I think that's one good thing that's coming out of it is developing and building on partnerships. We always make sure that we have PPE available to staff and clients, especially when we're in the field. I have 1 minute.
Actually, none.
Oh my God. Okay, before I stop, I have to say this.
Nope, no problem.
I didn't even get to go over my best practices. I'm sorry.
That's okay.
So the past 6 months, we've been under 3 pandemics. Nobody's really talked about this. There's the COVID-19, the racial injustices, and the murdering of Black men and women. So that has really affected our staff. And I think it's been exposed more now than ever in a way that we've never seen. Many of our staff members have expressed that their personal trauma has been triggered, as well as their depression. You know, a lot of our staff are living with PTSD. So their overall fear of contracting COVID-19 is not their only challenge. We've actually lost 2 very valued employees through this process, through this whole pandemic, and through the race wars, and through the racial injustices, and through their fear of being targeted. You know, one of the moved from the whole field of this work and is now working for FedEx because of fear of being targeted. You know, and all 3 of them feared contracting COVID-19. We had 1 employee who didn't show up for work for 3 days because they were depressed. So I'm saying this to say that we have to take care of our staff in order for them to be healthy. We got to get them at their best, put in support systems that need to be in place to support your staff so that they can best serve the community. Because it's hard to sit back and watch your staff struggle and be challenged like this and not do anything about it. And I'm sorry I went over my time.
That's okay, Lisa. All of you guys had so much to say, and I'm pretty sure that everybody on the call is appreciative to know what's happening. But we do have a couple of minutes left for questions and Q&A, so it's open for Q&A.
Well, I have a question. Lisa, you mentioned about technology training and text resources. I'm just wondering, where did you get the resources to be able to do that? You even talked about providing phones.
No, we're not providing phones. I think that was
Lisa.
Yeah, I meant Julie. Julie mentioned those things.
Hi. Oh, thank you. Well, because we are not spending some of our funds on the in-person events that I described and all the meals, we have extra funds that we were able to move around. So in terms of like where to get the funds, we have some phones that have been donated to us from Google. I don't think they've arrived yet, and I'm not in the development arm of our huge organization, so I'm assuming that was either offered or negotiated for us, but there's no Wi-Fi connectivity being offered with that. So we will still have that challenge, and that is an ongoing challenge. And in terms of the technology training, it has literally just been the staff. So in our 50+ program, Dusty Aruo has been, sitting on the phone with people and walking them through using the phone and using Zoom. So we've just had staff coaching. Trey Turner too in our BBE program has just been sitting with people and trying to walk them through it. So, and we've been training each other on how to use different technology to send text updates. We just had a training with the BBE staff to train our other staff on how to send text messages automatically to clients. So it's really been grassroots.
Thank you.
So I just want to make a quick statement because I know that we'll also serve trans women, and I don't know if that was very clear in my introduction or Tania's presentation. Just want to put that on.
Thank you, Ms. Barbara. I appreciate you. Thank you. I wanted to add that as well. Yeah, thank you.
And this is Gloria. I'll share. I saw in the chat somebody talked about personalized PPE or something like that, and I'll share the latest Allen Temple Health and Social Services mask that we actually have.
Nice.
getting ready to go back to do some work with our clients. I want to make sure that they all have these masks, and so somebody created those for us. I just also want to chime in. It's not a question, but Lisa, I have to say thank you, because the feeling of being overwhelmed by all that's going on in the news around us is so palpitating and real. We really even didn't talk about it. We're concerned about the clients and worried about the clients, but for us too, that whole, George Floyd and, what the police are doing and defund the police, I think we really should begin to do some roundtable discussions in general, both with clients and others, to talk about these things, because who else are we talking to this about?
Right.
And how is it making us feel?
Thank you, Gloria. I agree.
Mhm. So we just got a message from Rochelle. Some of us might need to go. If you have to go, that's fine. But if there are other questions and we want to continue, then we can continue. So yes.
Again, I don't know how often you guys have these town hall meetings, but I want to say thank you again for having us participate. I think it's wonderful when we can get providers. We really never have a chance to talk to each other. So, I mean, though we know about what's going on and we hear about what's going on, just to be able to get us all together and talking is wonderful. So thank you.
And for me, one of the interesting things that I picked up on all of the presentations is that each agency have little pearls that other agencies can benefit from.
Right.
And so that's what I heard. That's one of the things that I heard. It's like, ooh, that might be good for this, or that might be good for that. So thank you for sharing so openly and comprehensively. I thought that it was so comprehensive, and I've learned quite a bit.
Well, thank you very much.
Yeah, I just like to add one last thing, just for the group. We were speaking about the staff as well, and how we need to take care of ourselves as well. Self-care, as I had mentioned in my presentation, but World will be having a town hall on September 30th from 5:30 to 7:30. And it will be around being positive in the midst of COVID-19. So I think it's relevant. I think it's pertinent to what we're talking about now. So if you have the chance and you're available, try and join that. I think that we all can get something from that and benefit from that to take us throughout, our job and our daily functions.
So I think I did receive something from Demisha. So I will put it in the GAs, the general announcements that go out every Friday, our GAs.
Thank you.
Thank you, guys.
Thanks, everybody. Stay safe.
Thank you.
Thank you.
Bye.
Have a good day.
Thank you.